Hurrah!
Hurrah.
Right, welcome. Good afternoon. Thank you for joining us, especially Hayley, who's our guest audience today.
Talking to Hayley today.
We are joined today by the lovely Sarah Darling of Canine Gait Massage, who I absolutely love talking to, and I promise we will actually stay as on topic as we possibly can. But if we go off a bit, you know, it's going to happen. We'll come back. We will come back to topic. So Facebook was just doing its own thing, so we're on Zoom instead. So if you haven't been able to get onto the Zoom and you have any questions for Sarah while you're watching this, you can just message me, or we'll give you Sarah's contact details as we go along, so you can contact Sarah as well if you've got a question that you would like to ask. So Sarah, as I say, she is everything to do with massage and making dogs' lives much better. But I'm going to give Sarah the chance to introduce herself more thoroughly and tell you a bit more about who she is and what she does. Hello Sarah, lovely to see you.
Hello again. It's great to be back again, and thank you for inviting me back to talk about a subject that I'm just so passionate about. We all are so passionate about. It's a thrill just talking about it. So I'm Sarah Darling. I'm a canine massage practitioner. I was previously 23 years a sports remedial massage for people, and I transitioned over onto dogs literally for meeting a dog one day that was recovering from a cruciate injury, and I looked down at that little doggy and just saw pains that I'd recognized and resembled that I'd seen with people. And I'd not long lost my dog at the time, my last golden retriever. And I just really wanted to help. And then it led me then. I mean, this was a conversation that took us about half an hour last time we spoke, but I'm shortening this one. But basically, yeah, it led me into hundreds of hours of research. And it also then made me realize that I could have done an awful lot more for my dogs, even though thinking I was just the bestest pet parent in the world. But it opened up. I'd spent all my life with people and caring for people and their needs, environmentally and physically and mentally, you know, that I hadn't really considered the dogs. So that led me to a lot of research, and thought I have to do this and a transfer, so train then to put all those skills that I had onto working with animals, which wasn't as easy as I initially thought. It's actually quite complex, considering all the 23 years of training I did for humans. Believe me, I have my eyes, you know, really opened up. So as well as the canine massage part, then I continue to train and develop and do like strengthening and rehabilitation exercises, photobiomodulation, you know, the photozo, and lifestyle management, which of course is another big passion. I'm just doing a nutrition diploma, so it's not an area I'm going to go into at the moment, because you know I'm not expert in that, so that's what I'm doing next, and a first aid instructor.
I saw on your website earlier. I've looked at the picture. And
I haven't even. I did that 2 years ago, and I've been doing it for 2 years. But then, of course, as you know, like COVID hit, and as you know, for anybody then that does watch, I was caring for my mom, who was very poorly, who I've just very recently lost. So it sort of took its toll. But yeah, so I'll be going out soon and doing little canine courses, which is something that, once again, isn't it all part and parcel though, isn't it? It's all part and parcel. So canine massage, I know that we can really sort of get this idea that maybe, you know, if we've been to a spa and we lie there and they ask us, do we want to be stressed? Do we want this?
The cucumber on the eyes.
You know, I know, you sort of imagine, you know, sort of just lying there with all the oils on the face, and then you can sort of visualize that, well, my dog isn't going to like this, my dog doesn't need this, and my dog won't lay still for something like this. And we sort of visualize our dogs lying there with cucumber on their eyes, and that's just enjoying this massage, which incidentally, I have to say that my preconceived idea of swapping to animals was going to be something quite similar to that. How wrong was I? But no, it's a clinical massage therapy. So with me being a sports massage therapist, it's very similar in that way. So yes, it utilizes the Swedish massage. So you've got those lovely, slow, deep strokes. Then we have the deep tissue massage to get rid of all the tensions and knots. But then you have these sport-specific techniques, very targeted, that get rid of some either superficial or very deep restrictions, and when there is like spasms and trigger points, and then with some specific mobilizations and releases, and then of course then the exercise and things go with it. A dog can be lying down, it can be standing up. I have to say that out of 10 dogs, maybe 2 of them may lie down. I have some that literally curl up under my neck. I have dogs that I have to hold for 45 minutes that want to be curled up. It's wherever that you can actually do this, and it can be just 5 minutes to ease a certain restriction that's causing them a lot of pain, and then you can do some deep relaxation work then for 40 minutes. So it's quite in depth, but getting to that point of actually doing the hands-on part with a dog, that is what takes time. There's a lot of work before that, and identification and assessments. It's a lot deeper. I don't know if you want to ask, because I could go off now.
No, it's fine. No.
This is the problem.
I can sit here and just listen. I'll go and get some cucumber, as aforementioned.
Yeah, so, I'll let you kind of ask away if you want.
That's all right.
I will just go on then of like what it entails.
That's it. So yes, so as you mentioned there, just at the end there, it's not just about the actual physical massage part itself, but you've got the looking over the dog in many areas, and it's not just a case of going, they feel a bit tense, let's do a massage here. It's how they're moving, it's how they're standing, it's what they're doing with day-to-day activities, it's the changes that the owner has seen. So you've got all sorts of things like gait analysis and checking what the dogs actually are looking like, as well as how they're feeling. So generally, when you start working with a dog, so for example, you mentioned a little while ago about Brad, the border terrier. So that kind of a dog, where an owner has contacted you and said, I think this might help my dog, don't really know what's going on. What kind of steps would you take to get before you even get hands on?
So from arriving, it's like a full consultation. So it's a health questionnaire. So I need to know everything first of what they see, what they feel, the history from the vet, the clinical history, from any medications, any injuries, any illness and things, because these all play a part. For instance, it could be a surgery from 12 months ago. It could be an injury, crucial injury, anything that gives me a clue already in my head. It'll be a clue of, oh, that's happened. So these tension stresses or scar tissues would have built up, so that gives me a pattern that's going on in my mind about the dog. The questionnaire also then covers the exercise regime the dog has, the feeding regime, and also the lifestyle management. And so it's very important for me to actually, those first steps, the consultation part, that I do prefer to go to their home, because it's really important for me to see the environment. That's quite crucial in the management then of that dog. So we do the big sort of like a questionnaire chat, and also that gives me a chance then to build a relationship, get all the information I need, and get to meet the dog and get them to feel nice and comfortable in my company, because it's vital that I get that bonding with the dog, and so they feel safe and secure, and there's a trust and respect between us. Then following that, depending on their physical states, some are maybe a little bit pulling, we can't go out and do the gait, so it's maybe a little roam. But in Brad's, let's go back to say, just using Brad as the example here, then it's leash on, and we go out for a walk. And then I'm pretty much like bent down with my camera, and we're doing, I'm watching just from my eyesight, on top of the dog, underneath the dog, side, front, back. And then I do it all in normal speed, and then I do it all again in slow-mo. And that's something that I can really then look at a little bit later on as well.
So just to interject quickly there, now I obviously know this, but why slow-mo? What does slow-mo tell you that normal video might not?
Our dogs are like stealth mode. They can move extremely quickly, and to a trained eye, when you're actually watching a dog, you can actually see anomalies quite quickly. To an untrained eye, you can, because it's just, they're just so fast in their movement. Now, even to a trained eye, so I'm looking and I can see anomaly, I can see maybe the legs or the hips moving differently, a little bit of stiffness through the spine. But then when I go back and I video in slow-mo and I break it down into every bit, then it just scrutinizes it. So I can actually see, for instance, where like in fast motion, I'll see them going along, I'll see that the right leg is pulling medially a little bit. And then, but in slow-mo, for instance, that same movement, I'll see that not only they're pulling medially, but their paw is pulling medially and twisting, or there might be a little 45-degree pull as it comes back. So that is telling me further areas that I need to be looking into that might be causing discomfort, or just might be restricted, or just an area that I need to focus on. But also then it tells me where the offloading areas of that will be. So the slow-mo, and also you catch, importantly, say from the body part of that, obviously it's crucial for me to see in slow-mo, but also you see the facial expressions in slow-mo. So you can look at a dog and think that, okay, they're looking at you, I'm looking around, and then I watch it in slow-mo, and that dog, you've seen the whites of the eyes, you've seen the licking of lips, just while they're walking, not knowing I'm videoing them. Yeah. So you can already see that there is a stress element going on, and you can just the simplest little tiny little facial expressions it picks up, whether it's a tail flick that I've missed or an ear that I've missed, so that it's just really vital that I get that information, and it helps me create the best management plan. And also then with the questionnaire looking at, and then seeing their lifestyle there around their home and understand their exercise, it gives me a chance to think, okay, well, not only I've seen the anomalies, say from like the Gait analysis, but and then like the muscular analysis, but also it allows me to understand a little bit more of maybe the predetermined issues that may be there already because of a lifestyle. So I may sort of think, oh, he's walking fine, but let's just say then that particular dog runs up and down the stairs 30 times a day, jumps on and off the sofa, does this, does that, slips on laminate floors, various things. Then I'm thinking, okay, he's walking okay, but potentially I'm looking at that. So it's quite in depth, and generally, there's a simple consultation without doing too much to the dog at the start, just the whole examination process and the feeling process. Quite honestly, I can be up there till like a couple of hours, and I have to give that time, because also you can't go in there like if it's yourself, like you could say I've got a sore, and I'll just say, oh yes, this might feel a little bit uncomfortable, I'll be very gentle, but and you'll say, just get rid of it, I don't care, I'll drink wine tonight, I don't care. But whereas, if I go into touching my client too quickly and make them uncomfortable, they will not forget. No. And I might lose a finger in the process. So it's not worth it.
Make it easy for anyone then, does it?
Yes, yeah. And it's long term. And when you're dealing with discomfort, you are peeling back layers of an onion, and it takes time. It's not a shortly. Some can be done quite quickly, but when there could be potentially issues or long-term issues going on there. These things have been built up for a long period of time. And you're generally, we're not just looking at, and this is probably another question to get to, but we're not just looking at, you've noticed a particular anomaly or issue, or part of their demeanor has changed, their character has changed. You're not just looking at that, because it's never is just the one thing. That little bit of a movement or a lameness that you may have seen, it literally could be something that's developed and grow and established around the whole
That's
body.
it. So have you found, or do you find that sometimes by the time you're seeing, like you say, the limp going, or the dog maybe now doesn't want to get touched on a hip somewhere, by the time an owner is seeing that side of it and thinking, okay, my dog's telling me that they're uncomfortable, there's a chance that dog has had discomfort and pain and been adjusting for weeks, months, however long it might be.
And things, it can take years, to progress, like painful. I mean, just like this, we could be sat, it's like that wives' tale, really, isn't it? It's you sort of sit and you wake up and suddenly you can't move your neck, and then your mum tells you, oh, you must have been sat by a cold window. You ever had that? And it's just like, oh, that's it. Oh, it was the chill. I've got a chill in my But for instance, on the people point of view, there was one cyclist I was dealing with, and his suddenly got a pain in his leg, and that actually came peeling back the layers. I said that came back from an injury he had 5 years ago, and he only just felt it.
Oh, wow.
So things can progress, because if you think you go deeper down into the layers, like it got scar tissue forming, the fascia sort of grows over, remember, because it tries to heal itself, and then it sort of pushes through again, and then it goes up and up and up and up and up, and suddenly you go, ow. So things can actually take a long time, and we know that arthritis can take a long time to progress, and before you actually see that change develop, but it changes subtly. And this is the thing that we wanted to talk about is some of the different signs, because we a comment that was given to me a while ago, like, well, no, there's nothing wrong because he's not lame. and then you sort of ask, well, what do you perceive as lameness? And the lameness is a limp, the leg off and a limp, but that is not just lameness. That's acute lameness. The leg is actually off. It's so painful that it can't actually go down. But then there's the little limp, and then it's recognizing signs with that you get with the little head nod and various things and the rocking. But then you just get the anomaly where in Brad's case, where his legs sort of like just whisk and they circumduct out. Wow. They come out and in. So you've got this, and so you're saying, well, yes, Brad's lame. It's that word, isn't it? It's just it's the abnormal movement. He's not able to walk in that lovely straight line. Something is happening, and that's a lameness. So lameness isn't necessarily just that. So when they say, well, the tail is wagging, there's nothing wrong with him, he appears quite happy, there's lots of other things that we look at to see that. But
they can't be in pain, otherwise they wouldn't chase their ball. They can't be in pain, or they wouldn't want to go for a walk. I know. I'm the same when I go down to the pub, seriously. It's like, I can't come out, I got a bad back, and then say, well, I saw you down the pub once. All medicinal. So but that is one of the main things. It's just knowing that there are so many different things, and it doesn't always mean that they're in pain. That's pain, discomfort. We look at the different things that we can have, for women concerned, whether we have cramps, tummy cramps, or you've just got that niggling backache. We cope. We cope very well with it, but you just get on with it. And we can't speak dog. We can speak dog in the way that we can look at signs and things, and we get to see facial expressions, so we can understand. But and of course you have all this
kind of evidence and research, and it's fine, but a dog doesn't talk, so we can't know 100%, you know, what goes on in a dog's mind, but we're learning to speak their language in the way that they, you know, portray things. But I mean, it just opens up so many doors. But with, I'm just going to say, where we come to, we often say that, you know, dogs have silent pain. They suffer in silence. Well, we know that
they hide it, but
because we're learning to read their body language more. And then we say that, well, we're lucky because we can vocalize it. But just for anybody who is, other than Hayley, that's there, listening.
We did have Ruth pop in, and then she went in. I think it was showing an issue with her audio for some reason coming up as a message, so I'm not sure.
When we think of silent pain, and we're saying that, you know, where we can vocalize our pain and dogs can't, but then do we? So let's just look at that as an example. How many times, and I'm sure whether you have, I'm going to put my hand up now. I've been working on my garden the last 2 weekends, and I'm actually in a lot of pain. My back is hurting so much right now, but nobody would know. No. So silent pain, you know, you still go out, you get on with your day, and you can be in a lot of pain. So it's silent, the fact that, we just don't choose to say it's something that we just get on with. So yes, that is similar then to those in a way, you know?
So again, by the time they vocalize it, it's because they literally can't put up with it. Or if they vocalize it at all, you know.
That's it. It gets to a point that you know when that they vocalize, when you can tell when something is more acute. So you just have this chronic pain, which is the headache, the backache, you know, and the neck ache, and it just serves no purpose. It's tiring, it's draining. And then you have that acute pain. Then we know that that's the difference. And the acute pain is the sprained ankle, it is the inflammation. It's just suddenly that, you know, and it does what it's got to do to protect itself, but it can be flipping painful. We know that, but it has a purpose at that point.
Make you stop what you're doing.
But the majority, I think, for the long-term pain that really get you down, isn't it, is just the chronic, because it wears you down. And that's what I think what you see on your face, not just our faces. When you start to take time and pay a necessary attention and a different type of attention to our pets, you can see the changes in their face. I don't know if you feel that as well. And that you can see a more of a crinkly nose. You can see
I see it on the dogs I work with as well. On some, I see them and go, "How are they getting on today?" And before the owners even answered, their face does look like you say, a little line here, or it might be a little bit of extra tension going on around the jaw somewhere.
That's it.
They look like they might be a bit painful today.
And the eyes just drop, don't they? And they just look sad. So you can see that, but it's very, you know, and I like I said, I felt bad, like knowing more about dogs, and I've been doing this now for 5 years, and I know more about now, and I look back and I think, oh, I missed that on my dog, I missed that dog. But it's so easy, and I wouldn't let any of the clients that I work with think, oh, I should have done, I feel so bad. No, because do you know how easy it is to miss? You know, and life's busy, and we just get on, and we don't think that we need to be looking at things. They're getting on with it. We love going out for walks. We do these, you know, we just have these day-to-day activities that we do, and we don't really expect all of a sudden we just see our dog slow down a bit, and then we just think, oh, maybe they're just getting a bit old, and it's a natural progression, because as we get old, we feel it as well, don't we? And we just think, oh, that's it. Oh, I need to slow down a little bit, you know. So, but yes, these things are very easy to miss. And if you don't know, you don't know. And then it's
that's it.
Ourselves, you know, and the amazing CAM and these just incredible places to go and get this information that allows us to educate. Or saying, well, okay, you didn't know then, but we know now. What can we do? You know,
let's start from this point on.
Let's start.
What can we be doing?
From this point. Exactly.
So for a pet dog owner who might think, okay, so I'd like to know, in the future, you know, if my dog is starting to feel a bit of discomfort somewhere from whatever reason, they've done something funny in the garden, they've got to a point where actually they are getting a little bit of arthritis coming through, it's a recurring thing, you know, whatever it might be, what sort of areas, I don't mean kind of listing a whole load of things that dogs might do, but what might dogs do differently or stop doing that might indicate that there's something not right,
that they're uncomfortable?
Yeah. So, you know, when we think of pain, we think paw held up, not wagging tail, and going, oh, it hurts.
Yeah, and you know, and you may never see any of that, and that's the thing, you may not see any of that. And also, I'm going to get straight onto that, is also just knowing that, you know, there are times when these changes in movement and demeanor and things can be something as simple as, say, simple. It could be you know, you're looking muscle strain, spasm, trigger points, sprains, you know, you've got these things, but also underlying issues and more serious issues can represent the same symptoms. Yeah, you know, so it's always good to know that if you see something, before we get on to some of the different things you can see, is to look at the situation as a whole. And the minute you've noticed something, and this is something I've learned I would do straight away now, is even if I noticed, say my dog sit down a little bit more that day, I would make a note of that, oh, that's strange. Because if he does it the next day, I actually may be taking my dog to the vet. Do you know what I mean? So it's just, it's good at that point to think, we're looking at the whole, how many times, what are you seeing, how often in that day? We're getting on to a different thing now, and what tips we can do, but let's get back to what you said. Yeah, so different, okay, so when they're actually, what sort of things they're looking at. From a physical aspect, there's different elements. They can show physical signs, you'll see differences physically. And also you can see behavior changes. And this is a thing, sometimes they don't match up well, they seem a bit quiet, but they're still going on their walk. So they can show up in ways. So it's always good then to, if you spot the one, to really look at the whole picture. So similar things that you may just see. Here's one I just saw very, very recently, taking the dog out, that they complain that the dog kept stopping when we're on a walk. And they're just tugging, and they're just saying, my dog's got stubborn. Now, of course, you know, in some cases, I've seen dogs that are quite stubborn. They've got their own little characters. So we're not saying this is covering for everybody. But also remember, I said that it can be a sign for something else as well. Yeah, so it's just understand, I'm not saying if they pull, then something wrong. It really isn't like that. It really isn't.
In this particular case.
Yeah, it gives you an indication that maybe it's something to explore. So, yes, so you're going along, and you would normally do that walk, it wouldn't be a problem. And we think maybe the dog is just saying, you know, I want to go this way, but it just keeps stopping and staring at you. And this particular dog turned out to have arthritis in the spine. It was just one of those things, because I was checking out. And then in the end, you know, the video footage showed there was a little bit of movement. So pulling, just suddenly stopping through a walk. When you walking, and then you stop and chat to someone quick, and they lie down at every conceivable moment, that is another little indication that they're fatigued, or maybe there might be something going on a little bit sore. Especially if it's suddenly started and it's not something. If it's just something that is different to what you've actually seen. Another sign is I'm going by ones that I know that we've read about and seen, but the ones I'm telling you that are rolling off my mouth are the ones that I see all the time. So they go by experience, and I have known that they've led to something. So that gives you an idea of what I see. So because that is stopping, is fidgeting a lot when just trying to sit down. They're pacing a little bit, doing lots of turns, and then they go to sit down, and then they stand up again very quickly. Yeah. So that was another little sign. Another one is sitting not squarely anymore, dropping to one side of the hip or the other.
Yeah.
Now that can be represented as a lazy sit, because sometimes little dogs have lazy sits, but that's something that I would want to try and I'm sure there was a trainer on you want to get them to sit square to make sure that their muscles are nice and tight and, and they're balanced. So if they are constantly doing that, that will be, something just to keep an eye out.
Yeah. Yeah.
And I'll also go through a little way of exploring the body to maybe home in on some of these as well with you in a minute. Okay, yeah, so we've got that movement. Suddenly they're walking a little bit slower on a walk. They're lagging behind a little bit. And then also you've got a difference in movement, a sign that you wouldn't normally see, where they would normally move and walk in a lovely straight line. Suddenly they're kind of rocking a little bit and not notice that they're pacing, which is both forelimb and hind limb are working on the same side at the same time rather than alternates like that. So you get this little rocky action. Their head might be going up and down, which is necessarily their leg isn't off on a lameness, but it's showing that something's. So obviously then you've got the limb up. You may notice that the limbs aren't walking in a straight line, that suddenly they're starting to curve out a little bit. Something is changed in their actual movement. These are the physical signs, not behavioral at the moment. Yep. You may find that they are suddenly stretching an awful lot more, or you're not seeing them stretch as much. Okay. So our dogs can have a good stretch at the front. It's like the big downward dog, and then they come forward and they stretch the back legs out. And sometimes you can see that maybe they'll go for a little bit of a forward and they don't do the back. So they're not stretching like they used to. Maybe they've been coming up on the sofa and giving you cuddles, and then they're not jumping up as quick and they're struggling a little bit. Another one is that they don't jump down off the sofa as quick, they slide off. They put their legs down and walk forward to get off.
Or not get up on the sofa at all.
Or not get up on there, or the stairs, exactly the same. You may see, rather than stepping up over a little step with individual back legs going up one at a time, that they kind of start jumping up with both legs together is perhaps another little sign. And you may see that maybe when they're out running, something has changed with how they, there's different ways of that. They can do little skips when they run, or there's so many different elements to what can happen with their legs. So so the sofa, the sitting, the way they lie, has that altered? Has it changed position? Here's another one that I saw recently, when they said that they love curling up in a little ball. They're always really curled up, and it's lovely seeing our dogs like that, of course. But also, and I'm only going by this now as a recent experience, again, that I've dealt with, that curling up tight is a wonderful position for a sore back. Yeah. And it sort of takes that, like we would curl our knees up. I've got my knee up now because my back. I know. And it kind of like just stretches out the spine a little bit. So, but you may see a different position of that. So physically, oh gosh, I'm just trying to think. So the lameness, stiffness. We've got, you may see them trying to maybe gnaw and chew at a different part of their body.
Yes.
And this was, we could say, like in little Brad's case, he was running around chasing his tail, and in fact at a previous time he'd actually quite injured his tail quite badly from chewing, but however, there wasn't an issue with the tail. No. So we're looking at a revert. So if you've got an itch at the back of the eye, you can't get it.
No, you sort of go.
You might do this with your ear, or you might But you might see, unless, allergies and that have been ruled out, there could be licking and chewing at their paw. So if there's nothing there and you've checked for thorns or grass seed or anything, that is also sometimes I've seen so much lameness and soreness because of scuffs on their pads, and it's sort of like, eliminating all this, but yeah, so you can see chewing and gnawing. So that, I mean, physically, I don't know if you can pinpoint anything else. I think I've gone through, I just can't think of anything else at the moment. I wonder if I've made any notes, just struggling. Oh yeah, and the physical, we've gone through stretching, and then you've got, now this isn't always the case, but you can get changes in their coat.
Yes.
And I did actually a post on my Instagram recently. I don't know if you saw that. I did it on LinkedIn, as I've just posted it as well, where you did a before and after, and it was a little terrier. And you've got, just from an issue that this dog has spondylosis, but the compensatory issues that we haven't gone to yet, but compensations caused squiffs and squirrels and the hair to stand up. And it isn't always the case, but things that I have found with the dogs that I've worked with over the years, that sometimes I can see a squirrel and it just draws me into that area. And that's, I have found on many occasions that can happen. So when there is really something going on under there, but it can change your ear shape as well, it can change everything. And I have one little dog at the moment whose ears, it just literally there from the tension of offloading onto the forelimbs for so long, the fascia restriction has made the ears, rather than floppy because they're a cocker down, has actually come out right. They look like the wind has come up and they've stuck there, and that is discomfort. There's a lot of discomfort just from that. So there's so much. So you look at them, and obviously physically you can see that where they once, there's another big one where they wag their tail like this, suddenly goes to maybe a bit of this. And we know that when they're walking, generally, depending on their breed, obviously, but generally a tail will sort of come up to about there, and you won't get a lot of movement when they're walking, but you will get movement when they stand still. They're like this, but you will get this wag, and you can find that their tail, and when it's pointed out, you can see it more. The tail is sort of staying at one angle, or it's staying low, but you don't have that wag, so you can see a different shape to the tail, which gives an indication of things going on. So that is like jumping out the car, they're struggling with, and they hesitate before they do things. I'm
going to say, like again, the slippery floors and things, I know this is going to be hard. I've been fine till now, but actually, this is going to make it hard work. So I'm going to just go around an edge, or I won't even bother going in there. I'll just stay where I am. It's fine.
So you do start to see that. And then you're looking, so there are kind of like some of the physical things. You can physically see changes in their head, their back, their legs, their movement. And then you can see, sometimes you see first the behavioral changes, because maybe the physical changes have been quite slight, they've been so tiny, and because they're so fast you can't see them. So behaviorally can be, let's say that they're lying on the sofa next to you, or they've just been lying on the sofa, and you go and just suddenly sit down where they wouldn't have normally growled or barked. They growl and bark, and that has shown up sometimes as just because they're sore, and it's just that movement. So that will be you standing very still with a sprained ankle, thinking I can cope with this, and then you suddenly be on cobbles and it moves, or somebody comes and pushes you, and you're like, oh, don't touch me, it's a bit like that. So you get this reactive. So and yes, and that other behavioral side is the excessive barking. Can be, and it has, like, research has shown, there is a big link between behavior and pain and discomfort, and going by my own experience, I can say that I see that a lot, you know, and I've been able to identify that with my clients from their behavior and associated with discomfort. So behaviorally, you've got that reaction maybe at home. Behaviorally, you may see that out in the park, walking your dog, where they were quite calm, they actually got a little bit more reactive towards other dogs. And this is because it's normally you would have a dog on either a short leash or a longer leash. You go along a pavement, a dog will be coming the other way, and you allow them to do an arc and a curve. You know, you never want to walk two dogs together because that's quite threatening, isn't it? Would you say that? And that you would always want to give them the space to choose. You know, they've already registered what's going on, so they've either sniffing the floor or licking around, aren't they, and doing things to say we're good to go, I'm not going to hurt you. But when a dog may be experiencing discomfort, they're actually fearful, you know, they don't want to be hurt, so they kind of make that noise as if, you know,
get back,
I'm not feeling it today, and even though, so you may see that. And then it is, you know, it is that sort of like, and you know probably an awful lot more about this, is that pain with association, you know. So there's another thing where they would normally have been fine on the lead, maybe they pull on the lead, but each time they pull, you know, you're jerking them back, and then that can cause some tension. But if they're already, you know, feeling discomforts from other areas for a different reason as well, that pull is going to cause them to tense, which will cause something else to hurt, and they will associate that with it. Or if a dog is coming towards them, the dog's barking, so that you're feeling that tension on the lead and you're pulling, then we'll associate that bark with the pain. So there's a lot of association, isn't there, with pain. So you'll see little differences out on the walk. Within the home, or even without, you might find that they're not as quite alert, they're not as responsive to play with other dogs or people. They might be aloof, they might go and hide somewhere in the house, they might not know where to go, you know.
That's been Merlin with Aero, where he was quiet for the last week. He actually wouldn't come indoors. He was actually, because one of the areas she does, she jumps on him. So for obviously Hayley's already heard this, but for the people watching this on the replay, Aero, our Labrador pup, is 7 months and huge, and she quite likes playing with Merlin. But I know she's hurt him a couple of times, because he's literally stood still and gone, where she's hoofed him in the face somewhere. And she tends to do that the most as he's coming to the last little bit of garden to come into the house. She'll appear from God knows where and jump over him almost, and then turn around and slap him with a bum, or slap him with a tail, or slap him with a paw, and you go, try and stop her as much as you can. So he's actually gone to the point of, we've got a 200-foot garden, he now sits at the end of the garden, and this is a homely dog. This is a dog that likes his comfort and likes to sit with you, and he's actually giving himself little cubby holes to get in so that Aero can't find him. But where he's now feeling better, and I've done some of the physio with him, and he's had some bits and pieces, he's happy now, and he's bringing himself back in the house. But I was literally having to carry him back in so I could go to work. I didn't want to. So the stuff you see out on the walk with regards to being fearful of maybe a dog coming close and things, exactly the same. If you've got multi-dog household, exactly the same sort of thing.
You do realise he's probably got a little taser gun under his coat, so waiting for him to come in.
I suspect there's a few lying around the house under things, ready in case she turns up, and just.
He's probably there when he's in the mirror, sort of go, like, go on, put them up. So, oh gosh. So it's just thinking of behavior. Let me just have a little look-see.
Do you know, while you're looking, behavior, when I'm working with behavior, it's really, really hard when you're talking with someone and you see the dog and you instantly think, well, I can see what's going on with this dog. I can actually see that they are different to normal, because a lot of the people I work with are in classes, so I've met the dog quite a few times already. Or it might just be that I just happen to see something when I first start working with them, and they'll say, oh, the dog's doing this and never used to, but now they are. And it's a behavior, we need it sorted. And okay, we definitely needed to obviously sort it out, because obviously your dog isn't happy. That's why they're doing this. But have they had a full vet check? No, they're absolutely fine. They're healthy. No, and I'm not saying they're not healthy, but have they had any sort of check to rule out any pain or discomfort? Oh, they can't be in pain because of X, Y, Z. And it's really hard to then be able to try and explain, okay, what my feelings are, that yes, we can work on the behavior, but we're never going to get anywhere while there's something causing that behavior to have suddenly started. And dogs don't generally just suddenly go, do you know, I think today I'm going to be an absolute pain in the bum.
Yes.
For no reason at all. I'm just going to suddenly start growling at everything that happens. Yes, I think that's my plan today. Generally, something's triggered it somewhere along the line, if they don't normally do that sort of thing. If it's something that they've always done because it's part of their character, and they do it for attention seeking or whatever it might be, that's different. But when they suddenly start a new behavior, there's often a reason for it. Not always pain, but there's generally a reason. But trying to, that's what you were doing, was it? She says, yeah, I've got your trainer, mum. Here you go. I've got the inner soul out. Go to sleep if you're tired. So here we go. Behavior issue, tired puppy, won't go to sleep, teething, I will eat a shoe. Little bugger. I thought I'd shut it the other side of the baby gate, but I hadn't. But yeah, so this is one of the reasons why I wanted us to have a talk about this, is trying to help people understand that pain can cause so many things, and it's a real big one in the behavior world. There's so many different things that can be causing behaviors, and so many behaviors that we see. One dog, Taylor, one of my previous Norwich Terriers, his whole life, bless his heart, from when he had his pretty much the first week where he was going out and having proper walks, he was actually jumped on by a couple of dogs, bigger dogs that lived just a couple of doors down. So he ended, straight away had this bad experience and was therefore, reactive with dogs, but it was only a small reaction, and it was something I could manage reasonably well. And then by the time we got to about 6 years old, it was dogs that were further away. It was people that were having carrier bags in their hand. He assumed they were holding a lead for a dog, things like that. And it would get to a point where he just hear the noise of someone chaining up their bike out of sight, and he assumed it was a collar. He could hear jingling. And actually it then took me finding out a couple of years after that he had thoracic pain going on. Started work on that, and he did laser and hydro, and a few months later reaction stopped. All the work I was doing with him, and it was all down to his back pain, that again, no obvious signs. And now I look back and there were loads. His fur in the area never laid flat, ever. It was like a little surf wave, never laid flat. No matter what I did, I could strip it out, there'd still be a bit sticking up, little things like that. And it was all down to the fact that he just wanted, as he was getting older, this isn't working, dogs are still coming in, I don't want them coming in, I'm going to send them further away, so therefore I need to react much quicker. Yes. And I wish I'd done so much sooner with him, poor little boy. And I'd try and use Taylor as a bit of an example. But yeah, behaviour-wise, sudden behaviour changes doesn't always mean pain, like I say, but it's so often there's a reason for it. And we can manage the situation, and we can say to dogs, okay, well, let's do some positive associations and try and make it better and blah, blah, blah. But if the pain's still there, all they're going to do is go, well, I can't do that behaviour anymore, I'll do this instead then.
And you're so right. And it's understanding that, that this is why they are so incredibly linked, because pain can alter behavior, can turn into a behavioural change.
Does with me. I get really arsey.
I'm the same. I just do it with a smile on my face. I'm so upset now we've had to take the masks off, because the things I used to say under my mask, I can't do that anymore.
I have to remember I can't go.
I know. It's just like sign language now, isn't it? Sounds like.
John, my husband, he'll say to me, is your morphine patch due tonight? And I go, I don't think so. Why? He said, well, can you check the calendar? Oh, it is due tonight. How did you know? Just a guess. Am I being
put another one over your mouth?
Yeah.
Oh God. But yeah, and it's also, so you've got your pain, that the pain that actually can, obviously manifest into like behavioral changes, but also it's behavior. I mean, you only have to look at some of the rescue dogs that I work with, that that doesn't start off as pain. It starts off as behavior and stress. So they're in a stressful environment, and let's just not home in now thinking, well, yes, it's rescue dog. No, it isn't. We're looking at now within our home environment. Just think, maybe we've got a household with, lots of dogs, or young children, or maybe you're a grandparent, and then suddenly you've got this quiet old dog, and you've got, loads of kids suddenly come in and parties, and that you can get stressed, really stressed. And when we're tense, our muscles contract, everything tightens up. And if that in type of environment is going on a lot, lots of squealing, lots of shouty, as well as then, maybe, you're grappling with the dog a lot, or, trying to take toys out of his mouth and various things, it can create tension. And that tension over time can progress into physical pain. So it may not have started off as physical pain. So there's different, they're so linked, aren't they?
Hugely. A
huge link with that. Going on another behavioral thing as well, we're thinking, well, what is an indicator of something, is when they just suddenly start sleeping an awful lot more. That's another one that I have seen and recognized as part of.
It is exhausting. Pain, constant pain. It's hard work, isn't it?
It is. It is. But we cope so well.
We do. Pain. Oh, what's that?
Another one as well is panting. When they're not out coming for obviously they may start panting very quickly. That was another one, because that's something I've been dealing with another dog recently, so I thought it just in my head again. But so the panting, they haven't been out exercising long and they start to pant. And and we're not always looking at muscular issues here as well. Remember, a lot can go on just the same as humans. We get from diabetes and heart disease, and we have hip replacements, knee replacements, we've got lumbosacral, we've got spine, we have all that. So do our dogs. It's the we've got the spinal frame, we've got the hips, we've got all this, we've got all the muscles that are similar. We're kind of similar in a lot of ways. A lot of the dogs that I work with, I've got the diseases or just injuries. I work with my youngest at the moment is a 3-month-old pup, and I've got them right the way through, right up to 16 years old right now. My clients, the eldest client is 16 now, but my last one was like 19. They're incredible. But I go from pup, so I'm not just dealing with a 3-month-old and a youngest one, a 1-year-old with severe arthritis. So don't think for a second that arthritis is an older dog's disease. It can, like I said, it can take years to progress. So we look at that. So so the whole panting thing, that they can, if they're going into, like, they're just going into exercise and they just suddenly start panting a lot, that's something that I would certainly monitor very quickly. And then just, they're suddenly drinking a lot more, or they're not drinking a lot more, they're leaving their food. Remember, we're looking at, there's so many other things to look at. But if they're just at home and resting, and it's not too warm, and the windows are open and there's plenty of water there, and it's a constant panting, and then you can also see a bit of the whites of their eyes, that they've got a stressed glazed look. These are the things to also to make notes of, but the way that we can, then how do we notice them? We've just talked about such an array of different things. And this is why it's easy to miss, because we're so fast. Our brains are so fast. We're so fast. We're at home, if we're, not everybody is, but we could be on our phones when it's our business, and we know that if we're not working, when we check in or post it, we're doing things. So we've got our phones, we've got our computer. When we go out walking, we'll see people on their phones a lot. Within the home, you might have small children, you might be cooking dinner, you might have just so many things to get on. We don't actually, it's not that we don't want to, but it can all just happen so quick. Life's just there, and it gets in the way. And the way that we can notice this is to pay more attention to our dogs. Slow down and pause. Take a breath, not just within the home, but when we're out walking. Pause and see what is affecting our dogs. See the way that, just watch them, put your phone away.
Yeah.
Don't be grabbing them tight on the lead. Try not it to be a day that you've got 5 minutes before you get back to work. Yeah. Do it when you just take time thinking, I've got 10 minutes and I'm going to devote. If it's only 10 minutes that you have, I'm going to devote, if it's just a wee walk, I'm going to devote that 10 minutes to really watching and engaging and being, and just watch and see what they want to sniff, see how they're reacting, see how they're walking, how they're moving, see their reaction suddenly to a dog coming, see their reaction to a car passing, a child coming past on a bike. Think of the things that you wouldn't have given it a second thought. If you stop and talk to a friend, what are they doing? And get your phone. Here's an example. If you're going to get your phone out, put it to good use.
Yes.
Set it to video and video your dog. Yes. Video them walking around just for no reason at home. Video them sleeping, video them growling, video them eating, video them that. And if you're unsure, then just get somebody who has got a skill and an expert thing to have a look at that for you. And that comes in really good stead as if you're going to take you're unsure about something and you are taking your dog to the vet. That is the right time, because you can see all these things happen, and I can flipping guarantee you in the 10 minutes that you take your dog in to the vet, they won't see an absolute thing. And the thing is, though,
they haven't got time to do the walking up and down. And
but dogs still don't show it. It's this intrinsic ability. Just
oh no, I'm fine. It's fine.
I know, and I've known dogs. We're just talking about the one I'm working with now. This video footage, is just off the Richter scale. I mean, off the Richter scale. If I showed you so many anomalies, you wouldn't believe it. And yet a vet consult, nothing, no sign of pain, nothing.
Gosh.
Limbs moving comfortably, nothing. But also need to understand that soft tissue, then there's an x-ray and nothing. It doesn't mean to say there's nothing. And I know there's anybody listening to this, I've experienced this as well, thinking it's a something, but it's a nothing showing up. Soft tissue doesn't show up on an x-ray. You're not going to see that. So we're looking at us as people now, and I don't know if you have, I've had scans.
Yep, for me,
I've had all of that. Yeah. And then you come back and they say nothing, and then they send you to a physio, and the physio got me to lean over and circle a can of baked beans in my hand. I don't even know what was going on with that, but they give you exercises, but you think of all the soft tissue issues that cause us to be off work for months and even years that can't show up, that you just get an exercise. I mean, that we turn up at the doctor all the time, but these things don't show.
Yeah. But
they're built up over years from injury, illness, surgery, confirmation, the way we, this is what we're born with, how we are. It could be little deformities. It could be anything. And then you're looking at how we've carried our babies on our hips for this, how we talk on the phone and at a computer for years, how we carry a bag, how we can this, how we do this, how we do this. These can cause issues, tensions, trigger points, pains, change our whole formation, the way we walk, the way we, and that cannot be seen on an x-ray. So, and it's frustrating, but when you're looking at our dogs, it's the same. It's exactly the same. What's their lifestyle been like? What have they been doing? Are they, I mean, jumping for balls, laminate floors, on and off the sofas. This is an issue I think everybody knows. It's been sort of rammed down them, but years of doing a job agility, you know, we know that fly ball agility, you do a job for long enough, you're going to feel the repetitive stresses and strains of that job. You know, a typist will develop arthritis in their fingers. You know, tennis players, I work with footballers, golfers, even swimmers. You know, swimmers, they develop all these you've got this muscle mass, but they haven't got concussional force strength. It's all in the pool. So unless they go training, they're absolutely lax. Everything's lax. Wow. So they've got their issues. They've got their joint issues as well. So you know, it's the same. We'll say it's predominantly the same. If anything is overworked, you know, we look at a normal a scenario. I use this actually because my husband's got a tire factory. You look at a scenario, you put your tires on, they're normally going to last about 3 or 4 years. And a general journey is you're going down the road, you might curb a few times and scuff it a little bit, you know, which is just natural day to day. But you go A to B and you'll change your tires, you know, you go for a service. We take our dogs to the vet. Okay, we get them a little checkup just to make sure everything's going okay, because they've had a wear and a tear. So it's just a little checkup. And then you've got then the nutters, the nutters in the cars that skid off the drive because they've got some good wheels. Yep. You know, they kind of do the wheelies. They go over hills at 100 miles an hour, skid round corners, race dogs, you know, and their tires run out quicker. Yep. The tires fray, you know, and you've got this warning light comes on, and then they, you know, those kind of nutty drivers, they'll just continue on. They'll forget the warning lights of the fraying tires a little bit and the few dents on the side and the knocks and the paint chips. We'll ignore them and we'll go that other another 300 miles and suddenly the car blows up, you know. So it's like, think of these little things that you see and the changes that you see. I kind of think of them as like a little warning light. Yeah. And I'm not going to take then that car, that, you know, use that as a, you know, a familiarization, but that my dog, if I see a little warning light, I personally wouldn't want to take them on a 300-mile journey. I'd want to get that warning light checked up or see what I could do to stop it flashing. Yeah. See what I could do to ease that and make it comfortable.
That's it. Yes. Yes. I know of dogs that have had pretty serious injuries that they've then needed surgery on and a lot of rest, and they've had to obviously change some of their activities and things like that. And when speaking to the owner, they're kind of a little bit bewildered and by how the injuries actually happened and how the dog's got into this particular sort of state, saying, but you know, they don't do such and such a thing, and they didn't have an injury at the time, and they hadn't jumped off anything, and they hadn't done this and they hadn't done that. But actually, like with the car tires, some things that end up being quite a big injury, for example, cruciates, don't have to be one simple injury. Actually, it can be months and years of wear and tear, repetition, going on, that causes a tiny little tears here and there and little fractures here and there. And then suddenly, we just can't hold on anymore. There's nothing left here. And then it goes and it ends up becoming a big injury that we associate with, well, your dog must have done something. They must have jumped up and landed on their back leg then, or they must have, you know, whatever it might be. No, nothing. They didn't do anything. We were just walking along and his leg went. And it's just literally that time. It just can't take any more.
And it's understanding that. And this is something, and I just think from a parent's point of view, I know you've got to, I'm very conscious because you've got to go. We haven't even covered. There's still so much to cover. That's a good
have to do a part 2.
But something to home in on a little bit, it's just like you said, it can happen over years. This fraying, the cruciate disease can happen over years. But you know, we've got so many breeds, all these different breeds of dogs, and you know, more now with the breeding, you know, we have these predisposed issues, and it's a case of actually when you come to the tips, well, quickly I'm like, is it 4:30 you have to go?
All right, no, we're all right, we're good.
Okay. Is understanding your breed, understanding some of it may not actually happen to your dog, but understanding the predisposed conditions that come with that breed, because then it gives you chance to adapt the lifestyle around the management areas, to need to strength. I mean, sometimes you might, it's just going to happen. You've got cruciate disease, that's common with like larger breed dogs, but you've got this cruciate disease, and small, but you've just got, because all these things could happen with a trauma to any dog. But some of the dogs come with these predisposed, like hip dysplasia, luxated.
Aero, the Labrador, especially she's not my dog because she's going to be an assistance dog. I've got so many things in place with her that I would still have in place if it was my terrier puppy, but I'm doing it even more so because I'm so aware that she's growing so quickly. That she could easily damage herself, and how she hasn't yet, I don't know, because she chucks herself around like a bloody lunatic. And she's all leg, nothing else. But environment makes such a big difference, doesn't it?
It does, because you were looking at the different dogs, whether it is the little, like the corgis or the dachshunds, with the deformed. That's horrible to say, but deformed. But you have got these, so already you've got abnormal joints. So you might have normal forces, walking, running, on an abnormal joint. So if you're doing a lot more of a normal activity, or you've got normal joints on doing an abnormal activity, a lot of, these were the issues. But when they have these different joints, and they're susceptible, your breed is susceptible to these issues, then we can alter. But when it comes to environments, we'll get onto that subject now quickly, because I know it's another big one of ours, isn't it?
I'm all right. I've managed to move something slightly later, so I'm not as pressed. Slightly pressed, but not as.
It's just when it comes to environments, we know that we, as people, we have the ability to know that if we're not going to go and climb a mountain because we think we've got poorly knees. We know if something's going to hurt us, and we can protect ourselves from that. But obviously with our dogs, it's difficult. I know this is, I'm going to say this now. I often hear it, and I know you do too, because we've talked about this, when they say, well, my dog loves to go and play ball. They love to go and chase. It's their most favorite game. Well, when they were born, they'd never seen a ball. Can I just put that out there? The same as my daughter, and I swore I'd never give a chocolate because she'd never seen it. But the day I did, it was the worst thing I ever did in my life. It became the best bargain I ever had. What I'm saying is that we teach our dogs the behaviors. It's a learned behavior. And equally, as we teach them to do something, when we know that maybe potentially it might be causing long-term harm, and to speed up degeneration maybe in their joint, and cause them harm, then it's a learned behavior, and we can teach them another. And the good thing is that that can be done. And just from a very quick point of view, is that if you feel that is too much for you to do, and you have a dog that's reactive and you're struggling to do that, then this is why you have Joe. This is why you have the most amazing trainers out there that can do that. That understand the difference between pain and behavior, and help towards that. But they can help you. You can help. Joe can help you. That your dog change that behavior to to positive, to change them to enjoy something, and a behavior that is actually going to help them, and help protect them. So so it's a learned behavior. So when we look at our environments, remembering that a dog, I say, just does to run, generally go back into the wolf days. As I say, we're never there, so I can't really comment on it, but from what I've read, they just imagine, they go out, they go out, they eat their plant food, they eat their prey, and then they would just lie down, and then they'd sleep. They didn't have stairs, they didn't sleep on the, different beds. They did what they had to do, and then they'd rest. So they're very fit. They could just do long distances. And that's what our dogs are designed to do. And so, but of course, in our concrete jungle, it's changed. We've turned them into our sporting animals, of course. And we love the ones, and we've got these lovely little breeds now that we eat little couch potatoes, and we cuddle and everything. But then you're looking at repetitive actions, within our environment, that can cause them danger and cause injury, and have a negative impact, a long-term, you know, I know you'll see some dogs say, well, they're 17, they're perfectly fine, they've got away with it. You know, but then when you look at your 17-year-old dog, well, what were they like? Were they really crippled? Were they crippled from a 7-year-old? And maybe we didn't notice, you know, so, you know, we don't, you know, I'm not here to do, I'm just saying what we've learned, and the pressures and the tensions and the stresses and the strains on the joints. I've worked with humans for 23 years and I've seen the same thing. So I you know, I see this same thing. So we know that a lot of concussional forces, twists on the joints can cause injury. You know, we can step off we can go and play netball or tennis and do the same thing. So we know that if we're doing that action repetitively, the muscle, it gets these little micro traumas. So these constant concussional forces, twists and turns. And it is just like if you, like when you actually, you've got these micro tears within the muscle fibers. Now, say for instance, we broke a vase. We get the Gorilla Glue and we glue it back together, and it's never smooth. Well, mine are. It's a bit like that. Yeah. And this is what happens. Our bodies, they don't, you know, when you've got a little tear, it forms like that. It's never smooth. No. So these can develop and build up over time. Now, generally, microtrauma is natural. Microtrauma is just natural. You know, you bang, you this, you that. It just happens. And then, you know, the body just strips away the bad cells and then replenishes new. But if something is constantly traumatized, repetitive, it's inflamed, you know, and it can get sore and it just develops into more, and then painful trigger points and then spasms and changes in the body, you know, but then also, you know, you can get these chronically inflamed muscles and joints. And if the muscles get too tight, these muscles, you've got a muscle one side of the joint, you've got a muscle the other, they're all interlinked. They get so tight, and they can pull the joints together. Yeah. Which is going to wear them down. Or they get injured, or surgery for many forms of injury, when you're compensating, you're offloading onto another element. So that muscle gets really weak. So then those muscles go weak, and then they've got nothing to stabilize and pull the joints apart. So that causes the joints to. So things that we can do that. So you're looking at repetitive jumping for frisbee, stick and balls. A dog can run 50, 60 times, 100 times. I've seen it with the ball chuckers. You know, it's just a constant. Yeah. Now our dog's body,
on the back legs.
Our dog's body is designed. I don't know why I did that, by the way. I'm not sure I've seen a dog do this.
That's how Aero moves.
I've got some great video footage, but our dog's body is designed to move and twist and turn, but not repetitively. So if you think the forearms on a dog, the forelimbs, the wrist, they're our dog's brakes. And the back legs are the drivers. So you're leaping, you're landing, twisting on the legs and round, or they're having to brake hard and twist and turn. So short term, like I say, our dogs are designed to do these things, you know, but repetitively, time and time again, these can cause some issues. Those forces, we're not just looking at outside, and you're looking like for doing agility and flyball. You know, but obviously then we warm up our dogs, we train our dogs to do this. You know, we know about taking the jumps, don't we, that little bit lower now. Things have changed, haven't they, to make it safer and fun for the dog. So we're not looking at external environments, just external. Those are within the home. You know, so now you're looking at, we're jumping for balls, we're jumping on and off the sofa, or jumping in off the car, we're running up and down the stairs, we're jumping off the back of the sofa, you know, bonsai leaps off the back. And one of the biggest, which you said earlier on, is the slippy laminate flooring, tile flooring, wooden flooring. And this
just had a message up from Hayley, who says on slippery floors, saw a Vizsla puppy and the flooring was slippy, told them they needed to put a rug and a runner down, and the owner said that wouldn't happen because it wasn't aesthetically pleasing. And how often would we heard people
well, you know,
put a bloody mat down.
I know. Well, do you know what I always just say to them is, actually, and I can send a link, I can send a link to you, actually haven't got it, but even if you're on the CAM website, you'll see you can actually get the floor coating, and it's almost like an emery board. It's not it doesn't cause a shine, it's nothing, and it can actually do that. And then, you know, when you're looking at the laminate to a young dog is just the same. Another reason obviously to keep all the fur cut on the paw pads, by the way, because that's like wearing fluffy socks, isn't it? Yeah. But you're looking at running in from wet. You've got wet feet, you're going to skid even more. This is where slow motion comes in. And I did this for a client about 3 months ago. I do it for clients all the time, but this particular one, she swore blind that she didn't slip ever. So I did a slow-mo video just from the living room to the kitchen, and let's just say we lost count at about 20 slips. Wow. It was so tiny, so minute. But you are looking microtrauma. So you can tear ligaments, you can get fractures, you can get this. These are going to cause the tensions and the stresses and strains, especially then when you're jumping from a furniture onto a laminate floor, or jumping from the laminate floor. I've seen video footage where you don't even realize they are jumping up and their legs slip behind them to jump up. If you video stuff in slow motion, you'll see a lot more. Laminate to a young dog. Dogs need traction. They need traction.
Getting out of their beds when they first wake up, if they're getting out of their bed straight onto a slippery floor.
But that's it. And for a young dog, even a healthy dog. Yeah. But you get a dog who's old. Now you've got to imagine that, you know, when you're looking at a dog, maybe that if your dog is say 7 to 10 or whatever, think of your mom, think of your granny coming round, who's maybe had a hip operation, but who maybe is just fragile. Maybe she's just poorly. She's got arthritis. Mm-hmm. And you're saying to her, well, I'm not going to help you off the chair. I'm going to put you in some woolly bed socks, and I want you to go through to the kitchen and put the kettle on. You would never ask her to do that, you know. And it's the same thing. There's elements where you can injure yourself. These slips, they do happen. But for an older dog, a senior dog, or a young dog with an issue, whether it's a cruciate, like say patella, where they've just got bad back, whether it's elbow dysplasia or hip dysplasia, or blah 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 blah, go on and on. It's harder to navigate a slippy floor, because if you think just your basic tonus, just your supporting muscles have got to keep you upright. So if you imagine us walking on sheet ice, we'll go very slowly, but what muscles extra do we have to use to keep our legs in?
This is, sorry to interrupt, this is what I do compare it with, particular laminate flooring. And this Bislov puppy, 14-month-old, I was treating it for a strain in the quads, because she had a fall. And I said to them in the end, if they're not going to do the mats and the runners, at least get a mat to put outside of her. She sleeps in a crate. I said, can you at least get something so she's not coming out of her crate directly onto the floor? I don't know if they've done that or not.
It's hard. It's hard when they, but you know, it can be so difficult for parents, because if they can't see it, and sometimes the dogs will cope, they'll think that they're coping quite well. And this is why they invented laminate floors, didn't they? Because it keeps easy to clean, you know, that it looks really nice, and it's hard. It can be frustrating, you know, to keep mentioning, you know, the floors, but what's it going to take, you know, is the dog to slip over and really hurt themselves. But if they, like I say, if you don't see the dog, if you don't see a dog worrying too much about it, and they appear to be coping, and then they're really not going to do anything about it. The best thing I can do, you know, is do what I do, and actually just do it, video them in slow motion walking across, and you'll see the eye movement and the stress and the you know, and even when they're just sat, you find that their paws move forward, they slip, or their bum starts sliding backwards,
back legs stop
using, you know. But you're so right, Hayley, it's so hard, you know, these instances. And I you know, not everybody does want any mats on the floor. So so thinking, well, what can we do then? You know, at the end of the day, we're trying to manage a scenario here and help get the dog right. So what can we do? You know, because we want it to be achievable, and we want it to be consistent. So,
and also to have your own treatment work, because if you're treating an injury and the home environment isn't going to complement what you're doing. You're treating it, and then you go away, and then the dog's slipping and sliding all over the place, and then they want to know, well, my dog's still lame, what's going on?
That's it. Well, I'm quite now, I'm very fair, but also I'm very straightforward with my clients, and I just, well, I'm there, and I tell them as it is, and I give them all the backup information, but I just say as it is, but I generally find that with everyone that I speak to, that when they understand, when they've had that little bit of education, when they understand a little bit more, and they really get it, that they're just more than happy. And I've got to say, I'm like with the one client that had all the laminate floors, it looks absolutely stunning, I've got to say. They actually put the coating down, but they did, the compromise was, we got taping up the stairs because the little dog went upstairs, so we got taping on the stairs, and also mats at all the door thresholds, so the bed was by carpet anyway, so it was like, there's the compromise. Ramps to the steps outside, so we did that. And I have to say, why I mean, like the gorgeous little Brad that I was with this morning, that is another one that they've got like laminate floors, but it's standard. These gorgeous houses are built, and they do look beautiful. Yeah. And I have to say, by just looking at the videos and that, and then her understanding and just seeing how I took some mats around, and he just wanted to stay on the mats a lot, so we just saw.
Well, that's what I say to people. I say, if you put some runners down or some mats, the dog will gravitate to that, because that's where they'll feel safe.
Haley, you're absolutely right. And I've got to say, there's Brad's parents are just absolutely incredible, and they've just gone over and above. They've carpeted the stairs that we were doing. They've got the biggest rugs all over the planet. I mean, this house is just changed now for the dog, all in the space of a few weeks. It has been
that's really good. That's really good on your part.
They're seeing the change in that, and it's fantastic, but it's working. You need to work to get the right management, to get the results. You have to work as a team. You're working with vets, vet nurses, hydrotherapists, but most importantly, you're working with the mom and dad. And it's a team effort, and you work together as a team, and you get the results. So if you know that there's a situation within a household, and it could be anybody listening to it, but I love my house, I don't want to change that, and I see my dog's fine, and that is absolutely great. But then if we sort of recommend, look, within the home, these areas are potential dangers long term, what can we do? Well, I've got a little dog, they love coming up on the sofa with me. Well, I'll tell you what, there isn't enough room to put a ramp, there isn't enough room to put up steps for the dog. Well, a footstool. Have you got a footstool? Let's put a footstool, and then we'll just train her to know that that's her stool, and she'll step up. So now she's not jumping the whole leap, she's just going half. So what can we do to help? So it's working around to make it achievable. Achievable. So other quick tips. I am conscious of your time. So we've got stairs. So we've got jumping on and off the sofas. That can go literally, an average dog could be like 15 to 30 times a day on and off easily. You're looking at what, 25-30,000 times a year, plus jumping up at you for treats, plus jumping up at the postman, plus jumping for balls, plus how much are they jumping in the day generally, plus going up and down the stairs.
Out the back.
That's a lot of extra tension and stress on joints.
And potentially cold joints as well. Potentially cold body.
So if we can actually think of what can we do, what can you do now in your home, for anybody listening, what can we do to just minimize that a little bit? The exercise, rather than, if you can going out for a walk, keep them on leash, keep them on a gentle walk for about 10 minutes, give their muscles chance and their joints chance to warm up, get that synovial fluid going around, get that elasticity going, the blood going, circulation going, and then let them off the leash and monitor it. Don't let them go hell for leather, and on a daily basis. That is another thing. There's so many other things that we can do with our dogs in enrichment. We can have a whole session on enrichment, but warm up the dog's muscles, give them chance to warm up. So before you get to a park, or you've taken them out, you open the boot and they jump out and then they go straight off for a run. And that's where you can get some of these injuries and tensions and stresses and things. So yes, warm them up. If they're a small dog, you've got a car, I would be tempted to start picking them out a bit or get a ramp. And I know we see a lot of people that look at ramps thinking, okay, for arthritis and dogs with issues, ramp's always good. No, I actually think a ramp from the get-go.
I've got ramps now, all three of mine. I've got a 7-month-old, 4-year-old, 10-year-old. They all use the ramp in that van. Do
the ramp now. I mean, someone's actually say, I said that to someone. They says, well, I've got a Great Dane. They literally step out. There isn't even a jump. They just step out. Okay, we're talking really, I mean, but you are looking, if you go in the car in the morning and in the afternoon and you're doing it every day and they're jumping out every day, you look at how many times. Don't think, with a small dog especially, don't think of what you're doing outside is just their activity. If they're active in the home, when they say that, like a certain breed, the dog needs about an hour exercise a day. It doesn't mean to say that you just take them out in the morning, you take them out for an hour and you come back home. You've taken them, thrown the ball for an hour and come back home. Look at what they're doing in the day.
Yeah.
If they're running up and down the stairs all day, jumping on and off the sofa, doing that, and then you're taking them out and then they're running and jumping for a ball, we've got things. That's a lot of work, And
also, if you take your dog out in the garden, Aero likes doing a bit of retrieve, understandably, as she's a retriever. But I don't go out and instantly throw the toy as soon as we first get outside. I wanted to go outside and go to the toilet and have a mooch about and warm up a bit and go down the garden and back up with me perhaps before we do any kind of, and to be fair, I throw quite low. It's not very high at all because she would
coming from your aspect, and obviously coming from mine, I feel exactly the same. But you just said that you're actually throwing it low. So yeah. You're throwing it low for that reason.
Throwing it low. I'm warming her up first to throw it low for her. Or rolling it. She's
because they don't,
and that rolls. Frisbees roll. Nothing gets thrown high. Yeah.
Because you have to look at what are you trying to gain when you want to exercise your dog? What are you trying to gain? You want them to have fun.
Yep.
You want them to stay fit and healthy. Now, staying fit, I'm going to say it again, is stop exercising and start moving.
Yes.
Without causing any controversy. I don't think oh no, you can't not exercise. I mean exactly what I say.
Yeah.
Is that what do you want to gain from this experience? If you're going out for a walk and enjoying it as well, you're all going to gain something beautiful. It should be a big part of you both enjoying it.
Yeah.
But your dog they want to keep fit and they want to have fun.
Yeah.
Now, we've taught them to enjoy, to chase and leap for balls. But when your dog is jumping up and down and maybe it's on a sore joint, is that fun? It isn't really fun.
No, and they're going to do it because they're getting adrenaline and they're not associating what they're doing.
No, that release of cortisol, and that can stay in there for hours afterwards. They're not going to associate that it actually hurt them.
No.
So maybe that first few throws of the ball, they're thinking, oh, I love it. This is a great game. I love this. Thank you so much for playing with me. And then maybe it starts to hurt. I don't know. There's so much I don't understand about a dog and what they actually think, because I can't talk dog. But then if you're kind of doing something you pull them on the lead enough, do they think maybe you're trying to hurt them and punish them? Maybe you're throwing the ball and they can feel the pain because they think, oh, do I have to go again? Do I really have to go again? Are they punishing me? Maybe, I don't know. This is just speculative, by the way. Don't read into that. I'm just, so what are we trying to gain? We want to get them fit. We want them to have fun out in the lawn, out in a field, throw some of their kibble or their treats, bury some of their toys, get them to find it. You know, so many enrichment, go on to like ACE, you know, animal centered education, ACE and Tilly Farm.
Yep.
The free work and give you some ideas. There's some amazing Facebook things on enrichment, canine enrichment. And
free work is brilliant. Yeah,
free work is amazing. They and that balances them. Slowing a dog down allows them to be in tune with their body, highlight any discomforts they have so we can actually see them because they're not going health for leather. Slow them down and let them enjoy. Like when they go into the woods, they're not racing. You'll see them stop. You'll see them climb over logs and go in and out and smells.
Yeah.
They come back exhausted. They do, because they're full of enrichment. So they need to smell, they need to walk, they will need to move their whole body and enjoy. But going out and literally getting them to run and run and run and jump and jump and jump and come back because it'll tire them out and sleep, I think is not a recipe for success for their muscle, joints and mental health, because like us, it hurts.
Yeah, it says a lot about us and our lifestyle that needs to change as well, doesn't it? That we do just get out, get the walk done, get home. Yeah,
exactly. You know, 3 weekends ago now, I did climb Snowdon. I put a face on the next day. I don't even know how I functioned and did a client for 2 days. my bum muscles. We're using different things. So if your dog hasn't exercised for a long time during the week and then you take them out for this big blast at the weekend, believe me, don't forget their muscles in the same as they're going to feel the DOMS. Is it like delayed onset muscle soreness? They'll feel it. So they're going to get those same aches and pains. So it's being aware of that. But we can make these changes. So when going out, you know, take them to places with lots of smells, get enrichment. When you're out, get little bits of hankies and things. And I wipe the grass or pick up some straw, put them in little freezer bags and freeze them. And then when I'm ready, I'll take them out and hide them in hedges and do things. So then suddenly they've got smell. You're bringing smells to your garden, you know, so you can do all this enrichment stuff, puzzle toys and things like that. It doesn't all have to be racing. If they've got a ball, you're taking out to their favorite field, then just like Joe said, you know, you're throwing it low to them, throw it a few times and then avert their attention to another thing, you know, go and hide their ball in the hedge.
Hide it, throw it, have it in different directions. It doesn't always have to be forward, back, forward, back, forward, back.
Exactly. I had one of my clients who actually ran out in the morning because their dogs woke up early, always opened the door and went, 2 big German shepherds. And she went out and got liver at about 5 a.m. She got up and she actually, in their big field, she went and splattered this all over the field for them. And then when they woke up, she opened the door, walked out the door.
Gosh. Because
she started the liver from the door.
Right.
The blood, and, you know, and all over the field. And I got the most amazing video of these, because German Shepherds can be highly aroused.
Yeah.
Their arousal levels rather are very highly strong, and they just sniffed the whole lot. They had drool coming, and also toxins coming out their nose as they were decompressing because they were so like this. And so these things,
and I bet they came back and just slept
constantly. But after enrichment, you'll find that they do. You know, so that's things. So so ball throwing, getting some non-slip, you know, you can get some very posh ones for the people that do like the laminate floors. You can get some stunning little rugs, but in thresholds, by their bed, areas of corners. If there's a corner on there, because it's on the corners that can cause some damage. So ramps, steps, or a little stool to help get on sofas and beds. Non-slip treads and tape you can get to go on stairs that you don't even see if they're laminate, but carpet if you can. Coming in and out of a car, you've got a ramp, you've got steps or pick. Train them not to jump off the sofa or jump on, you know, train them to wait for you to lift them up if they're a smaller dog. As far as the car is concerned, especially maybe if they are sore, if you have got an older dog or one that has got arthritis or some underlying issues, then keep them secure, because movement in a moving car can actually cause.
Yeah, some of these liners that you can put in so they can't get in the footwell and stuff, they're just slippery, aren't they?
They're slippy, and they don't like it, and they wonder why dogs they're quite frightened of actually getting in the car at that point then. So you've got that enrichment in the house. We've got the non-slips. Did I make some notes? Yeah, I can't think of that there. And look at that. Say if you are getting a puppy, you're looking at young dogs. We've been talking about, like, middle to what age dogs now, but you're looking at their muscular, their skeletal system hasn't developed, and I see, kind of 10-week-old and 12-week-olds chasing after balls and going on long. I saw one the other day, just literally, it wasn't a client, this is a 12-week-old, and they just said they'd come back from one of the big walks, and the dog was lying down, and they said come on, and they'd be dragging it to get it to stand up, and it's very hard. And you're thinking, well, no, you have to know your breed, read about it, understand about a dog and the exercise. But these kind of concussive, continuous repetitive forces aren't bad enough on a normal joint, but you look on an undeveloped joint, you just have to be
and you might not see it straight away, but you're going to see it.
It causes deformities, at the end of the day, that it's underdeveloped, it doesn't grow, but then you've got the ligament that still does, and then you've got all these mishmash, and then it doesn't support the joint properly, and it's what it can lead to, and earlier. And then of course the big one is diet is crucial, and we know that, was it, you're looking, was it a CAM, wasn't it, they found, didn't they, with their research, that it became known that you've got 80% of dogs over the age between like 7 and 8 have got arthritis. Then you've got is it 30%, and these are like underestimated, aren't they? Yes, kind of like they are, potentially more than that.
This is going on cases that are actually registered. There's a lot of dogs undiagnosed.
It's just absolutely. And then of course then you've got overweight and obesity, and we're not used to seeing slim dogs so much anymore.
We're not. We were talking about this yesterday. We're so used to seeing so many breeds looking bigger that if you see, there's certain breeds, and I didn't want to sort of pinpoint breeds, but there are certain breeds, not all big, some of them are smaller breeds as well, that they've become so well known for being a certain shape now that if someone sees one that is actually slim, it just almost doesn't look right. They
I've been told that your dog's sick.
Your dog's, what's wrom with your dog? That's not the right shape.
Not right. And underweight. But the from a healthy dog point of view, just carrying those feed plans, so you're putting the pressure on the joints, and we know that, but you've got to look at the diseases that go with it. And this is why with dogs, they need to be lean. You need to keep that weight off the joints to be healthy. Don't forget, we're on 2 legs, so sometimes we can go up a bit, we can go down a bit, we manage to carry it, but it comes with its issues, with diabetes, that, and heart disease and cancers. It's exactly the same with dogs. They're on all 4s. So the first thing that happens, you can have changes in their back and their spine and their muscles and their dick, and they can't carry the weight. But also, you're looking mediators in the adipose tissue, in the fat, that actually cause inflammation. So when you've already got an inflammatory response going on in joints through like an arthritic joint, you put that then in there, and it's going to make it a lot worse.
So much worse.
Plus then all the knock-on other potential diseases as well. It's never just one, may not just be one thing that it will just progress, So if you think about it, we could really probably save potentially an awful lot on vet bills if we after their nutritional intake is healthy, not, can I say, crappy food?
Yes, you can. Yes,
say crappy.
That should become a technical term, because there are very crappy foods.
Just look at, be healthy, because you may want to go out there. I know the cost of living and everything's going up, but we can spend an awful lot on horrendous treats, very fattening treats for dogs, and I won't name the brands, but you can get certain ones that are for the teeth, that are meant to be, that it's like a McDonald's burger in calories, and it can and they're just treats, and there's lots of them, but they're very cheaply made. And I just think, we can spend a lot, but then you can spend a lot on vet bills.
You can spend a little bit more on getting the diet right for your dog, and a good diet. And I'm not going to promote a particular diet, because I don't for my dogs. They're on a specific type rather than a brand. But you can get a good diet that works for your dog best, and suddenly your vet bills are going to be right low anyway, and you actually save money in your dog's lifetime. But of course, initially it looks like having the cost-effective food looks like the better option, but actually it's counterproductive. You're going to end up
your specific type of diet is actually really good. And but that's it. It's what you can save a lot. If you can imagine, like I said, when we talk about the people side, if we go to the doctors all the time with back pain and leg pain, we could do so much about it. But then it's taken years to get where we are, but we want the quick fix. And sadly, we get to see dogs years in to an issue when we could do so much about it. Diet, a poor diet, overweight, obese can be can lead to developing arthritis early. And arthritis, then you're looking at maybe therapies to help manage that, and vet bills and x-rays,
pain relief,
and medications and pain relief through being that, which could lead then to many other things. So, and then, like I say, things can develop in. So I don't want to be the fun police. And, our dogs are generally really healthy. We are amazing pet parents. We do the absolute best that we can. And all it is just down to education. And education is, right, I've got this lovely breed of dog. I want to pay them lots of attention, because when we go out together, we want to have lots of fun and have this wonderful bonding. And, I want to give it some really good food, a good nutrition, not overuse the muscles and joints to make them too sore. I want to get them fit and healthy. Let's get the right advice now.
Yeah.
Let's get the right help now.
Yeah.
So, and then we can go on. One quickie, once again. I know that I'm sure that you're going to be saying we're going to have to stop now.
Yeah. Lots quickie.
Very quick. We've talked about looking to identify pain, and we've talked very briefly then about slowing down you, slowing down your dogs, taking time to look. Well, that's in the physical and the visual aspect of it. In the touchy part of it, okay, we did that on the last time I spoke to you. Can you see?
Yes.
Yeah. Okay, so this is Archibald. In the touchy part of it, and I'll go as quick as I can and make it very brief. We've got hand positions. When we and not everybody, but generally our dog will come up, we'll give them a quick, don't we? This, give them a rubs around. So we won't know if they're avoiding. We won't know if they're avoiding any pain state. We won't know if anything's actually, upsetting them or hurting them. So have a go that change your hand position. The difference is that if my hand's wide and I'm scratching from all angles, if I was to put that hand on dense foam, push it down, you wouldn't have an equal indentation, because your thumb is a little bit harder for pushing down, when you're getting your husband to get you to do what you want him to do. Or we've got the thing, different fingers with different pressures.
Yes.
So when we're stroking our dogs, we're going to have these different pressures. So from my perspective, if I'm going up and down a dog with my fingers open and a dog flinches or moves and gives me his head rather than his back end, I won't know which area maybe I push. So here's a good tip to do with your dogs at home is close your hands and make a little mitten, very soft in the knuckle. And you want to look at not just going over the skin, so you just touch the hair and nothing moves. That could be quite itchy and irritating. Think of moving the skin so you can actually see your skin moving. That's the pressure. It's just like a little 2-pound pressure. Go slow. Start from the top and just gently in this 2-pound pressure, an even pressure all the way. Go really, really slow. And then you can start by going down the forearm. And if that's fine, then move down. And I can honestly say to you, it works every single time with the dogs. I'll say, have you noticed any sensitivities? No, they love being stroked. I will get to certain points, and then you'll get this, and they'll stand up, they'll sit down, they'll move, they'll go to the side. That's at a point then that you can start to monitor what you've felt. But also doing that, if you've got your hands like this, you can't necessarily feel temperature or maybe lumps and bumps and things. So you will feel, maybe you might even think, well, the left side's a bit warm and the right is warmer than the right side. Why is all the feet cold? Why is one foot cold and the three are really hot? You know, these are little things then that we talk about, physical changes, physical ways of locating pain. This has got to be one of the most precious ways of doing it. So if you've noticed anything in your dog, behavior, or physically you're noticing some changes, take even more time to explore their whole body, under their pads, you know, under their arm. Don't miss out a centimetre.
No. Down
their tail, because believe me, that can hold tensions as well. But before you start, one of the quick tips, give a 5-second rule, is have your dog next to you and stroke them. Take your hand away and hold it there and see what they do. Because if they go away, they're not going to want you to do it again. There's something there, or they may just want to be stroked, but ask for their permission. See if they want that. Are they avoiding that? And that tells a big story there, you know. It's just maybe if you want to stroke under their chin or stroke them there, and if they just do this, do they move? You know, you'll learn so more if you just really bring it down and start exploring their whole body a totally different way. Explore it with intent. I think we said that before.
That's good. Yeah.
Touch them with intent, to look, to feel. You might find ticks, you might find grass seed in there, you might find a scratch from a cat, in your case, a dog. A scratch. They could have gone through a hedge. They could have got, which I actually found on one of my clients, an open sore that had got a little puss in it.
Oh.
It's actually gone through a hedge and been cut, but it was so big and furry, you couldn't actually see. So that was just from going slow, where normally the dog would just avoid and you wouldn't know. You're scratching his back and he lies on his back quickly to give you his tummy, and you think,
you want your belly rubbed.
So what I'm saying is that you can locate lumps, bumps, cuts, bruises, and then but also, you know, lots of other things. But take time to explore your dog at the slowest rate. So in everything we've just said is pause. Pause, listen, gain an attachment with your dog that maybe you haven't had before. Follow them around the house, look at how they're sleeping, look at what they're doing within your internal environment and the external environment, and become more of one. A real attachment. Take pictures, take videos, take notes. You know, do monthly diaries.
No, I've still got notes from Cassie and Taylor, and I've not had them. They've been passed. Well, they passed before I got Ripley, and Ripley's about to turn 4. I've still got their notes in a drawer somewhere in case I want to look back at anything, anything that ever happened. Oh, they did this today.
But it's just great. Oh, one other ever so quick thing. We talked briefly on
we haven't got time.
I know, because I just know what we're like. I know what we're like. Oh my God. I know. I could just be doing this for hours. This is why I need to come over and see you. It's just like a mad one.
What we can do, if we write some notes, and we can do a part 2 maybe in May.
Yes, we shouldn't we? And also,
I won't book anything else in for the whole day.
I know. Oh my God, we could do breakfast, lunch, and dinner.
There you go.
Do the lot change of clothes. We could have a PJ party.
Could.
I've got pajamas with puppy dogs. We could all get dressed up. We could have a big Zoomie, couldn't we, with everybody all dressed up in our best puppy PJs. No, we just quickly going on to massage or different therapies. Looking at massage from my perspective, when I did mine on the professional basis, I always and I didn't know to say, I always recommended, you know, don't come when there's an issue. Come before. Come before, and just have like little maintenance things to keep away. We talk about these like micro traumas, little micro tears in the muscles, or muscle pulls, the strains, the sprains and the strains, or all these little things that can happen in their bodies, and they can get build up over time, these tensions and restrictions. I work with a lot of dogs that have got no issues, if you know what I mean. They're healthy and they're fit. I can see them once every 6 weeks. I can sometimes see them once every 4 to 5 months.
Right.
As just a maintenance.
Yeah.
And every time I see these dogs, gorgeous, gorgeous dogs that range from pugs to Great Danes to Irish Wolfhounds, they have all got restrictions.
Yeah.
A spasm here, a trigger point here. They've reduced their range of motion that's affecting their mobility overall. They're having to compensate.
Yeah.
So I would say another way to actually help, and this is just not for me, I'm just putting this out there, is that to help maintain a dog's health, but also more importantly, it can also help locate something earlier.
A bit like when we go to the dentist for a checkup.
Going to the dentist.
Wait,
saying.
I'm just going to turn this round so you can see my lively 10-year-old laying in his bed in the corner there, like some sort of
look at the face.
Toy. Merlin has he's had luxating patella, obviously, but for people listening, luxating patella, which I could feel when he was 1 year old, and I took him to the vet because I needed the referral to get hydro, and I had to actually literally say to the vet, right, can you put your hand here? There you go. Can you feel it now? And he's nice and strong, and he's now 10 and a half, and he started I think October last year. I started taking him to a place an hour's drive away, only the best for my dogs, and for what I wanted was acupuncture or laser or whatever they felt would help him. And it wasn't because there's anything wrong with him. It wasn't because he was slowing down or stopping doing anything, nothing at all. I just thought, right, he's now 10. We've moved house. There's been lots of changes. I would like to just see if there's anything he needs. So I took him along and I explained about the patella, and I just wanted to check him over. And it was nice to have someone else get their hands on him, because of course, although I'm in canine fitness, I also know my dog really, really well. So it's harder sometimes to kind of monitor. It's a bit like when you see your dog every day, you might not notice a change as much as we might with a dog that we see once a week, once a month. And she felt him all over and said, oh yeah, no, I can feel the legs, but actually the muscles are really good. Front end's a little bit sore, but actually not anything more than you'd expect from a normal 10-year-old, let alone one that's had to compensate. And she said, no, I'm just going to feel his back, because I would imagine there'll be stuff going on with his back. She felt him up and down. She went, his back's great. Absolutely, whatever you're doing, carry on. But there were some little areas of just a bit of tension, a bit of soreness here and there. So now he goes once a month to have some acupuncture, or he might have a bit of underwater treadmill, or he might have a bit of laser, whatever they feel he needs at that moment. After giving him a check over, that's what he has. And he's such a happy little dog. And if that means that he doesn't have joint pain for longer, if that means that they might pick up on something that I miss lump or bump wise, well, why wouldn't I do that? It's not costing a fortune. Yes, it takes me 3 hours per session because of the drive there and back, but that's my choice to go to that particular person. And then at some point I'll get them to have a look over Ripley and see if there's anything she needs, because 4 years old, in theory she shouldn't need anything. She's not highlighting anything, but who knows? I don't know what's going on underneath all that body.
Say it only takes one trigger point you can't get rid of, just from stretching and a dog just being there, because it's all tense. So you got one trigger point that will develop and develop and develop and develop for one stomach spasm that maybe then in 3 months or 6 months time can develop into something that you don't want, and they start compensating. So it's like get rid of that, and it is just that health tech will just make them feel great. It is just, isn't it? It is just like going to the dentist. So I'd highly recommend, even if it's once every 6 months.
Yeah, I do know people who do agility with their dogs and other sports. They take their dogs for chiropractic adjustments. I don't know how often, but again, not because their dog has a history of having any sort of injuries, but they just take them to say, right, can you just check them over, make sure there isn't anything going on?
that it's a good health check, you know. But equally in yours, because yes, you can do muscular, you can do the gait and everything, but then when they're actually doing something that with you, like agility, you're seeing them move in a completely different way. I'm seeing them walk up and down a road or over grass. You're seeing them jump through the going on there, lifting on. You're seeing the different things. So you're seeing a different type of behavior. So how fantastic is that?
Yeah.
Actually, even just doing what you're doing can locate something before anybody else has even seen it.
I have a dog that's in agility. She's been, well, lady's got several dogs and she's been coming to agility for so many years now. One dog I think has been coming for about 10 years. A lot of my agility classes I've got older dogs in because we do a lot with them. But one of them had, over several months, small dog, had sort of slowed down a bit and wasn't as lively as she was, but she was only a few years, I don't know, 5 or 6. No limping or anything, nothing particularly outstanding. The more I saw her each week, the more I thought, this doesn't seem right, something's not right with me here. And then her owner said, could you have a feel for me, because I think she's putting on weight even though she's on less food than the other 3. So she gave me one of the other ones to feel for comparison. Then I felt this one and she was just solid, tiny little dog, solid. I went, oh my God, that doesn't feel right at all. So I said, and this was an educated guess just from reading stuff that I have throughout my lifetime. Okay, so she hasn't got energy. She really couldn't care about anything she does anymore. She's still got an appetite, but she's not eating more than the others, but she's not putting on weight as such. She's just got this solid body. Her stomach was just solid. And she'd lost fur on the tail. It was bare. You could tell from standing all 4 dogs together from the back, you could tell which one she was, because her tail was mostly flesh, no fur. So I said, and she'd been to the vets on and off, and they'd tried to work out why she couldn't lose weight and this, that, and the other. And I said, do you think you could pay for a thyroid panel? It's not something they offer. I know it costs more money. Yep, overactive thyroid. Been on meds for 5-6 weeks. My God, she's back to being, fur's all grown back, body's great, eating normally. She's so happy. She's now turned into a lovely, annoying, small, yappy dog. You know when your dog's feeling better because the behaviours come back sometimes.
Amazing though.
But she's great, and that's because I see her day in, day out, and thought, this isn't what she normally does. This just isn't her norm. But yeah, and that can make a huge difference. Huge difference. She's doing great now. She's doing really, really nicely. That's cool. That's
fantastic. There's nothing better, is there, just in knowing that, you know, that you've managed to kind of help or just educate or just see something. Because I've learned so much, and I consider that I have a skill, but I miss things all the time, and I talk to fellow, therapists and professionals as well. And we work together, even from hydrotherapy. I work so good with a wonderful hydrotherapist there, Ruth Puncher from Little Barn Hydrotherapy, and like I say, fellow therapist who's also vet therapist, a gorgeous one, Harriet Kickat. There's just some amazing people out there. And it isn't all just you. Sometimes it's good to have a second pair of eyes, because you get so engrossed in what.
Or it might be someone else that's come across something similar a few times or recently, and it's just in their mind, and they think, I've seen this, I've seen exactly this, try that. Yeah,
it is. Absolutely. And so it is, it's you just all work together. That's it. To me, it's one big team. I think if anybody has we've got that career in working with dogs, it doesn't matter whether you're a McTimness, you're a chiropractor, a hydrotherapist, a physiotherapist, a massage practitioner, that we've all got one thing in common, and the behaviors trainers, we're all doing the same thing. And so to me, it's a team, and we all work together to help each other to make our dogs fitter and healthier and happier, and educate. Because that's just what's going to do it. Because at the end of the day, it doesn't matter what we do. Of course it does, but it doesn't matter. It's like surgeries and this and what we do to help. It doesn't that. It's what's at home. It's what goes on at home. It's that continuation and that help and that home management. That's the key.
That makes such a big difference. Prevention as well as helping when you can't prevent something. But I do have to go.
No. I forgot, you talk so much.
I know I've kept you here for so long now.
I just love this. I think no matter we say, we'll come on for a quick hour. Yeah, right. Yeah.
This is a quick hour.
I tell you what, though, it's such
hours later.
It's such a pleasure talking with you. I just think you're absolutely wonderful.
Oh, I love talking with you as well. I do love talking with you. I can never express to people that they will enjoy listening. You need to come and listen, because even if you don't like the topic, you'll enjoy just the conversation.
I know, I do. But we just, we love it. And each time we just get that little bit more out there. But, we're just all passionate, aren't we? We're passionate people about what we do. And
we need a podcast that literally, like you say, literally is just two passionate pet professionals who just chat about stuff while they're eating their Pringles and drinking their drinks on the sofas, on Zoom, with their pajamas on, just talking about dogs, really. And
oh my God, so much more would come out. That'd be something to advertise. That'd be an interesting one.
So many things, couldn't we? Right, I'm going to, I probably should stop recording at some point. I'm going to stop the recording now. Hayley said, thank you, Sarah and Joe. I have to go now. It was lovely to be able to attend your talk. Some great advice given, Sarah. Thanks again.
Oh, Hayley, no, brilliant. I'm so glad you're here for all our friends. It was brilliant.
So I'm going to just stop the recording in 1 second. So thank you so much, everyone who is here and everyone on the replay. Like I say, if you have questions, you can either let me know and I will pass it on to Sarah, or you can contact Sarah via Canine Gait Massage website, which is not gait as in a swinging gait. Gait as in movement, GAIT. As I said it, I'm thinking that doesn't come out right. But I will, when I send this replay out, I will pop your contact details and everything all on there. So
Instagram, Facebook, whatever. Cool.
Millions of ways. Right.
Millions of ways. Thank you.
Recording now. Thank you so much, Sarah. As always, it's been lovely.